Charles Olorunfemi, and this is a show designed to improve health literacy, address health inequalities, and promote quality health. And today we're exploring a truth that doesn't get talked about enough. And I've tagged the show Mouth Care is Essential Healthcare, Oral Bacteria and Whole Body Wellness. Now, the mouth isn't separate from the rest of the body, it's the start of it. It's the home to a living ecosystem of bacteria, and when that ecosystem is balanced, it supports health. But when it's disrupted or imbalanced through inflammation or bleeding gums or persistent bad breath or untreated infection, it can become a quiet gateway to wider problems, affecting everything from confidence to sleep to how well the body manages inflammation overall. So this isn't just about a brighter smile, it's about prevention, it's about noticing the early signals, and it's about practical habits that protect your well-being long before pain forces you to pay attention. And with that in mind, I'm really excited to introduce today's special guest, Jaquette Chardae. Good afternoon, Jaquette, and thank you for coming on the show today.
Good afternoon. All that stuff was just amazing. I love all the stuff that you just said about how important oral health is. It was amazing.
I know
I'm
that's
glad
your
to be
passion.
here.
I know that's your passion. That's why we have you here on the show today. Good. So let me give you a proper introduction. Now, so Jaquette Chardae is a dental hygienist turned entrepreneur, and she's the founder of Curiosity and Courage, a brand rooted in daily habits, wellness, and taking action on your goals. She's also a certified in nutrition, and her work connects the dots between oral health, lifestyle, and whole body well-being. Today, we're digging into the oral microbiome, including the striking reality that the mouth can harbor over 700 species of bacteria. So, once again, hi, Jaquette, and thank you so much for coming onto the Health, Wellness, and Wellbeing Hour. All
Thank
right,
you.
good stuff. So now, before we get into the deeper science and the personal journey behind your work, let's do a quick myth busting round, okay? Because so many of us we picked up normal habits that sometimes they aren't actually healthy. So I'm going to read out a few common statements, and please help tell us if they are true or false, and then just give us one clear sentence on what people should do instead. All right.
All right.
So, true or false? Bleeding when brushing is normal.
False. Oh, do you want me to explain
Yeah,
why?
just real
Okay.
quickly. Yeah.
Okay. So it's false because if you cut yourself and you bleed, is that normal?
Mm,
Bleeding is not normal.
mm,
So yeah, that's
yeah.
a quick, simple answer.
Good. Thank you. Mouthwash fixes bad breath.
Fixes, no, maybe mask or cover up. Mouthwash wouldn't cover up bad breath. It doesn't fix it though.
Doesn't fix it. All right. Good. Thank you. If my teeth look white, I'm fine.
False. You might just use some bleach. Bleach and clean. Bleach is clean, but that ain't the
Mm,
same as cleaning in the mouth. So
good.
no.
Gotcha. Flossing is optional if you brush well.
Okay. I coined myself Mrs. Floss because
I
most
know.
people brush.
Yeah.
No one is flossing. So you need floss. So you have to floss just as much as you have to brush. So I'm pushing, brushing in the background, and I'm letting floss shine. So anything you hear about not flossing, push it in the background.
All right.
The
Gotcha.
floss, you have to do it.
All right. So thank you for that, Miss Floss. Okay, thank you. So and that's clear and actionable. And if there's one takeaway already, it's that oral health isn't just about avoiding toothache, is it? You know, a lot of people think, oh, it's just about avoidance. As long as I don't have a toothache, I'm fine. But it's about prevention, it's about inflammation and the bigger picture of the whole body well-being. All right, good. So let's build on that, Jaquette. Thank you so much. Now, for listeners meeting you for the first time, please explain to them who is Jaquette, and what do you do?
Hello, everyone. I am Jaquette. I live in Alexandria.
Mhm.
I am originally from South Carolina. I've been in Alexandria for almost 11 years now. I love it here, the DMV. And I'm a hygienist, and I'm also growing a brand, a wellness brand, a holistic
Mhm.
wellness brand.
Mhm.
And my ultimate goal is to open a travel center truck stop.
Okay. All right.
Yeah.
All right. Good. Thank you. Now, I've heard you say before that the mouth can contain up to 700 types of bacteria. Now, when people hear that, I'm sure that they'll panic. I think I did panic the first time I heard that. But please explain, what should we understand first about those 700 types of bacteria?
First, to understand, 700 is a pretty large number when you're thinking
Massive.
about
Yeah,
bacteria. But
definitely.
then you also have to know that
Mm.
even though it could be 700, the majority of them are not bad.
Okay.
Our body is covered in bacteria.
Hmm.
So if our mouths have 700, I don't think it's 700 all at the same time.
Yeah.
Like there's 700 bacteria that could be in your mouth. But
Hmm.
on average, it's not a full 700 different bacteria
Okay.
from the information I've gathered. It's
Gotcha.
not 700 at one time.
Hmm.
But all of the bacteria aren't bad, and the bad ones you don't want to get out of control. So
Hmm.
it has to be a balance, harmony.
Okay. All right.
So yeah, I wouldn't be afraid because bacteria is we need bacteria.
Okay.
Bacteria is necessary, and it's whenever it gets out of control is whenever it becomes a problem. Well, bad bacteria, not just
Bad
bacteria.
bacteria.
Bad bacteria. Yeah.
All right. All right, good. We'll come back and talk about that in a moment. But first of all, what made you move from being a dental hygienist, from the cleanings and the checkups, to building curiosity and courage? And also at the same time, what problems were you trying to solve as you build this, as you start this your entrepreneurial project?
Okay, well, Curiosity and Courage is really a full circle
Mm,
brand,
okay.
being that the idea for Curiosity and Courage came from me wanting to open a truck stop. That's
Mm,
my ultimate goal, to open the
okay.
travel center.
Right.
And I am into taking care of your body, loving on your
Mm,
body, loving on yourself. And I know moving your body,
hmm.
eating good food,
Hmm.
having clean air, all those things make a difference in the quality of life. And
Definitely.
I know at that time, both my parents were suffering from different chronic diseases. So,
Mm,
what I wanted to do was be able to provide anyone who was along this interstate highway and
yeah.
over here in the US,
Yeah.
95. I'm pretty sure most people, if they're over here in the US, they've heard of I
Hmm.
95,
Hmm.
who may have wanted to have better quality food and cared about what they were putting in their mouths. I wanted to provide that for them. So it started off as a soup and salad smoothie bar, and then it
Right.
snowballed
Mm,
into the truck stop idea.
okay.
And I knew I don't. So I knew one thing. I didn't know what I was doing. That's something I didn't know. I don't know how to make that happen. I've been talking to people. I've been
Yeah.
asking
Yeah.
people. So I'm curious, like,
Yeah.
what? And so me being me, I was kind of like, oh wow, this could be something super big, but
Mm,
it's gonna need a lot of power behind it.
yeah. Yeah.
So I knew it would take courage. So
Mm,
that's how curiosity and courage has come about, was to have ask the questions.
yeah.
Can I? What can I do?
Yeah.
How can I do it? Or who
Yeah.
needs to come
Yeah. Yeah.
along? All
Yeah.
these questions. So I asked that to form the travel center, and I know it's going to take courage. So
Yeah. Yeah.
courage, faith, God, it is going to
Determination.
take a
Yeah.
lot.
Yeah. Yeah. Yeah.
Yeah.
And I'm sure
Yeah.
you're on your way there already. So, and what I really actually like about that is that you actually started. Because do you know how many people are out there? They want to start a business or they want to start something, but they're waiting for everything to be perfect. before they start. And that in its own self, there's a bit of a flaw in that. Because rarely are you going to see where everything just falls into place and everything is perfect. So kudos to you for at least getting it started, and well done to you, man.
Thank
Good
you.
stuff. Yeah,
Thank
good
you.
stuff. Yeah. So let's talk about oral microbiome. Please explain what actually is the oral microbiome in plain language, and why is it important? Why does it matter?
Okay, the oral microbiome is like, how can I say it? It's it's an ecosystem. That's what I can use. I can say it's an ecosystem inside of our mouths. We have an
Mm-hmm.
ecosystem inside of our guts,
Yeah.
our skin. We have skin
Mm-hmm. Mm-hmm.
microbiome. So our
Yeah.
body, the inside and the outside, is covered with bacteria. That's just what it is.
Okay.
And our oral microbiome that helps us break down foods. It helps clean things. It helps move things out. It,
Okay.
it
Mm.
it's an ecosystem.
Okay.
And what was the question about oral? What
Yeah.
was it?
Why is it important? Why does it matter?
Because it how can I say this? It's just a part of what we need. That the oral microbiome is just
Yeah.
is. I don't have a good answer for that. Like, it's just what it is.
Yeah.
It's just a part of our bodies. That's how humans are made. We're covered with bacteria.
Mm-hmm.
Inside of our mouths, the
Mm-hmm.
bacteria is trying to
Mm-hmm.
keep out too much of the bad. It's trying to keep everything in harmony.
Mm-hmm.
So
Mm-hmm.
it's just what it is.
Okay. It keeps everything in there in harmony. Yeah. So
Yeah,
we'll take that.
yeah. The
That's
oral
good.
microbiome
Yeah.
is fighting bad guys. There's some crazy things going on. If we were
Yeah.
really like paying attention to what was going
Right.
on in our
Right.
mouths, they're
Right.
fighting
Yeah.
crime.
Mm.
There's people trying to do bad. It's a whole lot of action going on in your mouth.
Okay. Now, good stuff. All right.
So you got to find balance.
Okay. So let's look at that then. So, and you mentioned before that not all the bacteria is bad, isn't it? So let's look at the difference between the good bacteria and the bad bacteria within the mouth. Mm.
I don't know the names of the bacteria.
Yeah, yeah,
What
yeah.
was the
Just I
question?
mean, just generally speaking, just the difference. Any particular difference that comes to mind between good bacteria and bad bacteria within the mouth?
Mm, good bacteria. Okay, so I can say this is yeah. Okay, with yes. So if you have a lot of bad bacteria in your mouth, and say you're eating a lot of sugar that's
Mm,
feeding it, you can end up with a cavity.
right.
Um, Say because you're not removing the back good. Well, you're not removing the bad bacteria, and you're not helping the good bacteria fight the
Mm,
bad bacteria. So
mm,
now
mm,
you got a cavity. Then if it's going on around your gums, now you got gum disease. If it is if it's going on in your mouth, now you got bad breath.
right. Yeah,
So a
yeah.
cavity, bleeding gums, all of that could cause you to have bad breath. There's something when you have bad breath outside of in the morning, because even if you brush and floss at night, you can still wake up with morning breath. So outside of in the morning, you can if your breath is smelling, you got a problem.
Got a problem. Yeah, yeah, good. And let's look at that problem actually, because if we look at the mouth, there is different neighborhoods. I mean, you called it an ecosystem, isn't it? Previously, so we could like there's the tongue, there's the gums, there's the teeth. Where do problems usually start from, and why?
Mm, the start of it is just in the mouth because
Mm,
everything works
mm,
together. Like it's
yeah.
not like you're not working just your teeth. You're not working so everything is working together. So
Mm,
it
mm,
starts in your mouth, and what area will you notice a problem more
mhm,
or sooner is on the teeth. You unless something happens to your tongue, you really won't really notice much on your tongue. Your tongue
mhm.
don't only just show you things that's going on with your mouth, it can show you things that's going on with your body.
Okay.
So your tongue can show different things.
Mm,
So whenever someone thinks about a problem in their mouth, they usually think about their teeth or their cheeks. Say they got it's
mm,
most people notice problems in their or on their teeth. That would be
yeah,
the
yeah.
main place.
All right, good. And are there any particular warning signs that the mouth ecosystem is out of balance before, like
Bad
before
breath.
maybe before real pain starts? Okay, just bad breath. Okay.
Bad breath.
Mm-hmm.
Uh, any other warning signs? You might feel an ache.
Mm-hmm.
Bleeding gums. Bad breath. Bleeding
Mm-hmm.
gums.
Mm-hmm. Mm-hmm.
Those will be about the warning signs, but most people, or
Yeah.
they could see something if it's a visual, like maybe they see discoloration or something going on.
Okay. 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 What about
Yeah.
the when the teeth are very very sensitive? What's all that about?
So tooth sensitivity
Mm.
mainly comes from like gum recession. That's usually the main culprit when it comes
Okay.
to tooth
Mm,
sensitivity. So
mm,
if you're experiencing tooth sensitivity, maybe it that could come from maybe you're brushing too hard
okay.
or you're grinding your teeth.
Mm,
Like when you're sleeping, you might not even be aware of it that you're grinding your teeth. So that can cause
mm,
sensitivity.
mm.
Um, Maybe if you've had ortho and your teeth shifted pretty fast
Mm,
and now you got sensitivity after
yeah.
having traditional ortho or braces on your teeth.
Yeah.
So
Okay. All right.
it's a few things.
Yeah. All right. Good. Thank you. Thank you for your insight there. Now let's look at. I'd like you to try to explain this as much as you can. So we often hear that oral health affects whole body health. Okay. And some people, I've remember somebody said, "Oh, nah, they don't believe." So, but if you could please explain, what's the most credible way that you can explain how oral health can affect the whole body?
Um okay.
Mm,
Your mouth is important.
yeah.
Like whenever you heal yourself, usually you're using your mouth to eat good food. When you are trying to heal yourself, you might take a pill
Mm,
to get in your system. So
hmm.
all this stuff is going first from your oral
Yeah.
area.
Yeah.
So when you think about all that has to pass through your mouth, you want it to be up to par because it's taking something from the outside, you're entering into your body, and now your body has to be ready for whatever that is that you put
Yeah.
into it.
Yeah. Yeah.
So
Yeah.
the oral microbiome is like the beginning. It's the beginning of healing. It can be the beginning of healing far as eating foods or healing far as taking medications if that's what you um, feel will help.
Yeah.
So
Yeah.
it's the beginning.
Okay. That's the beginning. All right. Good. And gum disease sometimes also gets normalized, isn't it? Sometimes like bleeding gums or bad breath, people begin to normalize it like it's just something normal. But please explain, what is this? Why is this a big deal? Because obviously it's not normal. Why is it a big deal?
Because your body is waving at you. Your body is saying there's too much
Mm,
going on. I
mm,
need help. You ain't helping me. He is bleeding, is waving the red flag.
yeah,
Hey,
yeah,
I need
yeah,
help.
yeah,
So
yeah,
there it's
yeah.
telling you there's something going on.
Mm,
So
mm, mm, mm.
whenever you have those issues, your body is like, you're not helping me. I'm trying to make sure you're good. I'm trying to make sure you got your teeth here, but
Yeah,
you ain't helping me. So now if this tooth has to get taken out,
yeah.
I was trying to tell you. You
But you
wasn't
weren't listening.
listening.
Yeah, yeah, yeah. Good, good. So always important to pay attention to those signs and symptoms. All right, good.
Yeah.
And if someone who maybe somebody who might be diabetic, somebody who might have heart issues, or a woman who might be pregnant, what oral health basics do you want them to take extra seriously?
I'm gonna be redundant. So
Yeah,
this is gonna I'm gonna sing a song. Floss.
floss.
You you
Okay, Miss Floss.
you have to get because
Mm,
people are brushing. They're not
yeah.
flossing, so they're
Mm,
leaving things in between their teeth,
mhm,
and it can cause other issues.
mhm,
So if you're trying to take care of your teeth while you're going through pregnancy,
mm,
have heart disease, one
mm,
thing you can do as far as like maintaining the health of your mouth is to floss. So that will be something I always and highly recommend.
Miss Floss recommends that we floss. All right. Well,
Every
I'm sure
time.
we're not going to forget that one. Yeah. And and,
Yeah,
and
don't
what's
forget it.
and what's one mouth-related symptom that people shouldn't ignore for weeks or for months? One thing, one symptom from the mouth that we should never ignore.
If you have like a bump on your gums, if
Mm,
you have a bump on your gum, because sometimes you may not have pain, but if you feel around your gum, like, oh, there's a bump there,
yeah, yeah, yeah,
that
yeah.
will be something. Because some people, if they bleed, they don't really,
Mm,
they bleed, like, oh, my gums bleed. They're like, they're aware of it. It's not like,
yeah.
it's not probably gushing out. So they're probably not
Mm-hmm,
going to pay too much attention to that.
mm-hmm,
But if they
mm-hmm.
have a bump, that should be something that gets looked at, or go to the dentist to get checked out.
Check that out. All right, good. And if you had to give a 2-minute daily routine for most adults, what would that routine be? I know floss is going to be part of that, isn't it? What would that
You already
routine
know.
be? And would it be AM or PM or and then just in your answer, just explain if that routine should be morning or afternoon or evening.
If I could give